Hi, welcome to the Body Shop Physical Therapy. I am Dr. Catherine Price and I'm a physical therapist. Today I'm going to go over walking pain-free. A common goal of my patients is to be able to walk with less pain or without any pain at all. Now I can prescribe exercises for strengthening, work on alignment, mobility, but then taking that and applying it to your everyday movement patterns is another concept. And you can work on and improve all these things, but then we want to apply them. And making small changes can have a big impact. Now, before I begin, I'm going to speak a word of life from Psalms 23:4. Though I walk through the darkest valley, I will fear no evil, for you are with me, your rod and your staff, they comfort me. So when we're walking, sometimes we don't think about our walking, it be automatic, as it should be. But when we do walk and we're having pain, there are small adjustments that we can make. Now, if you look at yourself in the mirror and you have bow legs, then you are probably putting pressure on the inside of the knee and wearing the inside of the knee. If you look in the mirror and you have more of a knee knocked position, then you are probably wearing the outside of the knee if you continue to move in that pattern that applies that stress. So looking at the bottom of your shoe or just standing, and as you walk, I want you to assess, where is the weight? Is it on the outside of the foot? Is it on the inside of the foot or in the middle? So when I stand and I take a step, I want to make sure that so if I'm looking down, that toe right next to my big toe, so my second and third toe, I want to be able to feel the earth, feel the floor with those toes. If I am putting more pressure on the outside, then I am causing that varus deformity, that bow-leggedness that wears the inside of the knee. And if I am putting weight on the inside of the foot, then I am wearing the outside of the knee and in a valgus deformity. So I want to have my weight on those second and third toes as I am propelling or placing my foot on the floor. Now, the biggest key to walking pain-free is using the buttocks. A lot of times we're in forward and just hanging out here, and that does not allow us to use our butt muscle or our glutes appropriately. Or if our glutes are weak, sometimes there's a lurch gait and you're just leaning back and not using the glutes appropriately. So if you can use the glutes, your buttocks muscle, you will be able to decrease the stress on the low back, the hips, the knee, and the ankle and foot. So we want to engage the muscles properly and watch where our pressure and our landing is in the foot. So when the foot hits the ground, all that stress goes up the body and it will affect the joints. So what I want to focus on first is engaging the glutes. If you stand and you squeeze your butt, you should feel the chest rise. So we're going to get that nice anteversion in the pelvis, that tilt, stacking the spine. The glutes are going to be key. Now, if I stand on one leg and I squeeze my glute, I should feel myself start to lift and control that forward movement. I'm going to step down, placing the foot, watching that my alignment, my foot is fairly forward and I'm getting the pressure on those mid toes. And if I take my toes, I have a good grasp on the floor, so I can put pressure down and grab the ground, so to speak. And then I'm going to lift my leg from the groin, squeeze my glute on the opposite side, and bring my leg forward. Now, as I do this pattern, I should be in more of a glide, so I'm not hitting the ground hard. I'm going to keep my ankles soft, and I'm going to move using the glutes, using the buttocks muscle. So I've got my hands on my hips and I'm just going to work on engaging that glute. I'm going to lift with the groin on this leg, squeeze my glute on the opposite, bring my foot down, lift from the groin, squeeze the glute on the opposite, forward, squeeze my glute, and forward. So it's something you can practice, and as you practice it, you should feel a smooth walk. There's not going to be as much stress that goes down into the ankles, the knees, the hips, and it supports the back. So the gluteus maximus, the buttocks muscle, is one of the biggest stabilizers in the body, and utilizing that muscle as you are walking, it can help you become pain-free with your walking. So you can strengthen that muscle, but if it's not used during the activity, you're not getting the benefit of the glute muscle. So those two things, paying attention to where your foot is landing and when you are turning on your glutes, and are you using your buttocks when you're walking. And it can take some time to get used to. So it's something where you can go out and go for a walk, and you may have to concentrate on walking and do that for some time before it becomes automatic. So this is one way to implement a strategy after doing exercises and alignment work. You can then take this and put it into practice and hopefully have some reduction in pain if walking is something that you want to do and you're having pain during your walk. You can refer to the videos on the Egoscue method for knee pain, hip pain, or foot pain if you're having any trouble with chronic pain in those joints. That can help you with the alignment. And then you want to take and use this in practice and apply it to your movement and see if you can have some reduction in your pain. So those are just some tips for being able to reduce your pain and stress on the joints in the lower body when walking. I hope this is of help, and have a blessed day. Thank you.